All right, guys. Hi again. It's Dr. Ketchy. So we're going to start a high risk pregnancy series, or just a high risk series. With this series, my intention would be to address a few medical conditions or conditions generally, even surgical conditions that could make your pregnancy high risk. So for starters, today, where should we start? Of course, let's talk about the woman's age. Okay. Um, as far as classifying pregnancy in high risk, it's based on the age above 35. Most of us know that. Now, why is this important? It's important because it increases the risk to the pregnancy by way of it increases the risk of miscarriages. Okay. Um, this would be as far as the quality of the eggs. Um, because at the time of your birth, all the eggs that you would ever have in your entire lifetime is already present when you were a baby. But in any case, the other thing is it increases the risk of chromosomal or genetic abnormalities such as Down syndrome, which is the more common ones that most people have either seen or heard about. There are various other chromosomal or genetic abnormalities that can be increased based on age alone, the mother's age in this case. Yes, paternal age has also been implicated, but we're still studying as far as how it affects the pregnancy or the fetus specifically. The other thing it does is it can also increase the risk of you having diabetes in pregnancy, having high blood pressure in pregnancy. Sometimes it could increase the risk of you having twins, gestation, or multiple pregnancies, which in and of itself can be a good thing, at least to some people, right? But also it can affect how the baby grows, whether the baby grows enough or too little. Okay, it can also affect if you're having any medical conditions like complications like high blood pressure or diabetes, like I said earlier, that could determine if you'd need to have your baby. That's a lot of have tos early. As far as indicated preterm delivery, whereby I would say based on the continued risk the pregnancy is better for you to deliver early. So, what can you do about that? There, as we really can't hold your age as much as most of us would like to, you know. Well, I don't really think I want to hold my age. I just want to find the elixir of youth. Youth. Let me bite my tongue today. Um, all right, seriously. So those are some of the risks involved based on advanced maternal age. Now, does that mean a woman who's above 35 should not try to get pregnant? No, that doesn't mean that at all. What it basically means is that when you want to get pregnant or when you do get pregnant, you need to find an OBGYN or even an MFM. Yeah, I'm still pointing to myself. um, and they would watch your pregnancy very closely from the start to finish because would need to see you very frequently. You need to get ultrasounds done very frequently. Um, so yes, it's not a sentence that says you should not have a baby ever again. No, it's just that we need to monitor you